Hello, my name is Brittany Dykstra and I'm a resident at the Mayo Clinic in Rochester, Minnesota. I'm here at the ASH meeting presenting the results of a study titled PET-CT has major diagnostic value in the evaluation of smoldering multiple myeloma. We know that patients with smoldering multiple myeloma have a higher risk of progression to active disease as compared to those patients with MGUS. We also know that there are some patients within those that have smoldering multiple myeloma that are at even higher risk of progression, particularly within the first 2 years after diagnosis. Our study looked to use PET-CT as an imaging modality to determine if positive PET-CT findings correlated with an increased risk of progression to active myeloma within 2 years of diagnosis. This study was a retrospective chart analysis. Essentially, we scoured the Mayo Clinic electronic database and identified 200 patients who had a diagnosis of smoldering multiple myeloma and underwent a PET-CT as a part of their evaluation while at the Mayo Clinic. We then analyzed those charts to determine if patients had positive PET-CT findings versus negative PET-CT findings. We described a positive finding as radiologist interpretation of focal increased FDG uptake and or osteolysis on the CT part of the PET-CT scan. Ultimately, we found that 33 patients had positive PET-CT scans and were observed per current smoldering multiple myeloma guidelines, and 101 patients had negative PET-CT scan findings and were observed per multiple myeloma findings. Interestingly, there were about 54 patients that were upgraded to active multiple myeloma. 14 of those patients were upgraded based on PET-CT findings alone. For patients who had positive PET-CT findings, again, there were 33 of those patients. Approximately 56% of those patients progressed to active multiple myeloma within 2 years. We further restricted our analysis to patients who had PET-CT within 90 days of their smoldering multiple myeloma diagnosis. 74% of those patients progressed to active multiple myeloma within the first 2 years of diagnosis. For patients that had negative PET-CT findings, the rate of progression to active disease within the first 2 years was 26%, both for patients, all comers, as well as patients that had the PET-CT within 90 days of their diagnosis. This was a significant difference, again showing that PET-CT positivity could have implications for patients at the time of diagnosis of smoldering myeloma. Based on these findings, we did conclude that PET-CT does have a major diagnostic value while evaluating patients with smoldering multiple myeloma. And in fact, our data may be an underestimation, as 14 patients in our study were upgraded to active multiple myeloma based on their PET-CT findings alone. At this point in time, the myeloma working group will be recommending that patients undergo PET-CT as initial workup at the time of diagnosis for smoldering multiple myeloma. The hope is that this may help us identify those patients that are at the highest risk of progression to active disease within 2 years.